Itagat kokeny kimi ketesetai keng'ololi akobo kaimutik chebo kabwatutik kemitei ak daktari psychiatrist Dr. Hilary Tarus. Daktari, before we went for a break, we were talking about, you were breaking the categories of the mental illnesses.
Right.
Yeah. So what are the symptoms? Maybe begin with the one which was immediate, that is bipolar or something.
Okay.
The symptoms.
So before I tell you the symptoms,
Yes.
it's important to put a disclaimer that having a symptom does not necessarily mean you have a
You have the bipolar or
you have
or mental illness.
or you have schizophrenia. Right?
Yes.
For example, one of the symptoms of malaria is a headache. But not everyone who has a headache has malaria.
You're right. So it's like any other disease.
Right.
Okay.
Yeah. But these are just signs that maybe you should see a doctor. Right. So, like we can talk about some bipolar mood disorder, or let's talk about depression. Right? We've talked about the
Yes.
poor sleep quality, not eating well, social withdrawal. We even have poor self-care or poor hygiene. Right? You can have someone being irritable, easily upset by things, problems concentrating in work or class. Unakaa chini unasoma lakini unasikia vitu haziingii. You can have problems with your memories, remembering things. Yeah, these are all symptoms of maybe a depressive disorder. Now, when we talk about bipolar mood disorder, umeuliza, one of these two types of bipolar, one of them is the manic. That's the one that's we can talk about today. With mania, with people with bipolar mood disorder type 1, you will have them exhibiting a state called mania. So how do you know a patient is manic? You will have racing thoughts, mafikira ziko mingi, talking excessively, and when they talk, they are not able to stick to one point. Like, for example, you ask them a question, what did you do today? They will tell you, today I went to the school, and then I studied. After that, I went home. And then at home, because our home is made out of stone, people who are building our house today made of this stone, they actually came here. Yeah, they were actually building very hard, because building the house is something that is very difficult. In fact, when the Nairobi Housing Corporation was building this, like, you asked them one question, but now they're talking about something else. Another thing is people with mania are not able to sleep. Yeah, that's usually the first symptom they'll come with before they develop mania. They'll tell you, or the family member will tell you he was unable to sleep. Another symptom of bipolar mood disorder is being excessively religious. Excessively religious. Si ile ya kawaida, ile anaomba kila wakati. Alafu delusions. They have what is called delusions of grandeur, grandiose delusions. And ile anajiona yeye ni mtu, someone who is very important, that they have a specific role that they were placed here on earth to fulfill. Then they might also harm themselves, maybe hitting the wall or screaming or shouting, being very suspicious of other people. They'll tell you, my mom wants to kill me, or he wants to do. Now, when we talk about psychotic illnesses, what are the symptoms of a psychotic illness? Psychotic illnesses are all characterized by a state called psychosis. Sawa sawa. Psychosis tumesema ni ile wakati mtu anasikia vitu ambazo ziko. A patient will tell you, I'm hearing voices, I'm hearing people speaking in my ear, telling me do this or do that, or they're talking about my life. It's like they're announcing the things that I'm going through. They're like news anchors. And then when we talk about substance use disorder, the most common being alcohol use disorder, which I feel is not talked about a lot, or is not even identified as a mental illness. Yeah?
True.
Excessive consumption of the said substance to the point where it affects their productivity. They are aware that the said substance is causing negative ramifications on their work life or on their social life, but they are unable to stop it. Right? Anapoteza kazi lakini bado anafanya hizo vitu. But I'll say this, the most common symptom that you meet in patients, almost across most mental illness, are two things. How well is a patient sleeping? How well is a patient eating? How well are they interacting with people around them? Is there any change in their productivity, in how they work? Again, also, taking too much of a substance can be a symptom of an underlying mental illness, or indulging in an activity that is addictive can be a way in which people are trying to treat themselves of a said mental illness. When we talked about depression, we talked about the dopamine, right? This chemical that makes you feel good, right? That is not adequate in patients who have depression. So you'll find people with depression might indulge in activities that generate depression in their brain, like drinking alcohol, like partying, or like gambling, like indulging in risky sexual activities. I've seen a patient who, I don't know, is this in pleasuring themselves sexually, because it's also a form of a way that they can induce dopamine to be released by their nervous system.
Oh, okay.
Also, to add this, how well you dress, how well you observe personal hygiene. Poor self-hygiene, poor self-care can be a symptom of mental illness. Before you asked me, do you just look at someone and know that they have a mental illness? But it's usually a very long process that starts with you looking at them. How well have they maintained their simple personal hygiene? From there, you can move forward. So a person who is not taking care of themselves, when you look at their apartment or their house, it's not well groomed. And this is a person who you've otherwise known to be clean. That can be a symptom of an underlying mental illness. Right? But like, remember we said before, just because you have one of those two, don't be quickly to say that, I have this. My cousin, yeah?
Yeah, because I'm sure like many of us now are pointing like,
Yeah, my cousin came to Koito na kukula. Anakulanga chapati mbili. Alikula moja this time.
Could be a sign.
Yeah.
So at what point now should you like seek help?
Okay. That's a fair question. Yes, because we've said not all, not everyone. If you have just one, you've noticed said something, doesn't mean you should rush to the doctor. So when should I rush to the doctor?
Yes.
But let's talk about depression, because that's one of the most
common.
If you have thoughts of self-harm, or if you've ever attempted self-harm, that is the first. If it causes a significant change in how you if it affects how you're functioning, how you go to work, how you interact with other people, then it's time to see a specialist. With anxiety disorders, again, not all forms of anxiety are considered to be pathological. Just because you are anxious today because you're a business person and you don't know whether there were going to be maandamano today, just because that doesn't mean that you need to see Dr. Tarus, no. With anxiety specifically, for you to say that it could be pathological, it has to fit a certain criteria. Number one, it has to affect your functioning. Like, you're not able to work well, or you're not able to go to work, or you're not able to broadcast the news today because you're feeling anxious, right? That's the first step. Number two, if that anxiety is still there, even when you're out of danger, then it could be a disorder. I'll give you an example. Say we're in this beautiful studio, right? And then we had gunshots outside. And then you started shaking and sweating and having a very fast heart rate. These are symptoms of a panic attack. But I'm not going to say that that Carol has an anxiety disorder, because you're within the vicinity of danger, because I can attribute your reaction
to what has happened.
To what has happened, right? Let's say, for example, God forbid, it was we were being robbed, right? And then we underwent a traumatic ordeal tonight, and I was not able to save you. But 2 months down the line, you're in your kitchen and you're remembering today's event, and you're shaking and you're having palpitations and you're having a full-blown panic attack because you're remembering the events that happened today. See, you're having a similar reaction, but you're not within the vicinity of
the happenings
of danger. Then we could say that Carol might be suffering from an anxiety disorder, specifically post-traumatic stress disorder, PTSD, which is another thing altogether. Another thing, the anxiety has to be more than the threat at hand, right? Say, for example, something happened to you when you were little. Maybe you were chased by a dog, you know, and then you have phobias of dogs. Then I brought a small puppy to the studio,
yes,
and you started shaking. And I'm like, it's just, so you see, it's not, or maybe you saw a cockroach in the kitchen, and you were just there shaking and sweating, right? The threat is disproportional to your reaction to the threat. Then in that particular case, we can say she might be suffering from an anxiety disorder. To be specific, it's called a specific phobia anxiety, like in the two case scenarios that I've painted. Yeah.
Okay. So maybe
Oh yes, and then the last thing, the anxiety has to cause the patient to avoid the stimuli, to be significant avoidance of the stimuli. For example, you underwent an accident 2 years ago, and these days you go out of your way not to get into a car. In fact, you'll walk from here to
to town,
to high-rise estate, right? You're doing your level best to avoid that. Yes, that's significant.
So boarding a vehicle because you think that an accident could happen again.
Yeah, because anxiety is not necessarily a bad thing. It's actually a good thing. It's actually a tool that helped us to survive back then, because the world was not always this safe. It's only in the last 60 years that we've had good houses, that we've decided to lock all the wild animals into a national reserve, that we have the KDF, the Kenyan Police Force, sometimes helping us and saving us. So what I was going to say is, picture like 100 years ago, right?
Yes.
Picture your grandfather somewhere on the slopes of Rift Valley. He's walking around, right? Back then, Rift Valley was not as safe as it is right now. You see people going to Naivasha, you know, and just having good time. Back then, it was a place that was filled with wild animal. If you had a grandfather who was more anxious or was easily anxious, for example, when he was walking at night, he would hear some bushes crackle behind him, and his anxiety would tell him, that should be a lion. Let's get out of here, right? And then the second case scenario, you have a grandfather who's not anxious at all, right? He would hear some bushes crackle behind him and think, that's just the wind. 1 out of 10 times, there could have been a lion there.
Yes.
So the one who was anxious was more likely to survive. Another thing I'll say about anxiety is that anxiety disorders are twice as likely to affect women than men.
Than men.
Yes. Women are much more likely to develop anxiety disorder more than men. Well, I mean, there's very many theories as to why that's the case. But one of them is because women just evolved to be more anxious than men, because traditionally they used to take care of the children. An anxious mother is a better mother than a mother who's carefree.
True.
Right? If you see a small rash on your child, you're like, hey, let me take him to hospital.
Yes.
No, msicheze karibu na moto. No, I don't want, you know. Yeah, that kind of thing.
So how can they be helped now? Or how do you treat these patients?
Treatment. So initially I'd mentioned that treatment usually involves two things, or a combination of those two things. So the first one is called, we just call it psychotherapy. Some people call it counseling, some people call it therapy, right? With the case of depression, this therapy is usually mostly done by someone called a psychologist. A psychologist is not a doctor, but is a person who has a master's or a PhD in psychiatric illness, in human psychology and behavioral sciences. So in psychology, they teach you how to control your anxiety or your depression. What could be the cause of your depression? What are some of the things that you should, the triggers, right? How do you deal with some of your past traumas that could have led you into the situations that you are in right now? For example, with a patient who has a panic disorder, the panic disorder that I talked to you about, they learn what are some of the triggers of my panic disorders. What should I do when I'm feeling anxious? What is the routine, right? What should I do about it? How do I live with my illness, right? People with substance use disorder, why are you drinking? What are some of the things that are causing you to drink? What should you do when you have the urge to indulge in a substance? And then, so the advantage of therapy is that it's very effective. It's very cheap because you're just talking to someone. But also it does not have really any side effects like medications would, right? Yeah. But it's time consuming, and then we don't have a lot of specialists and therapists in Kenya to conduct it. So the other way you can treat mental illness is using medication. There's many types of medications that are used to treat mental illness. Sio tembe tu moja unapea kila mtu. There's many types. With mood disorders, we give things that are called antidepressants, right? For people with depression or with bipolar mood disorder when they're in the depressive phase. So what these antidepressants do is that they try to restore the balance of those chemicals that I talked about, be it dopamine or serotonin, so that you can start to perceive the world around you like normal people would do. People with who are in manic episodes, we give them medications that are called anticonvulsants. That's true. Or are called mood stabilizers to sort of like lower, to bring them down. Yeah. And then people who have psychotic illnesses like schizophrenia, people who are seeing things that are not there, we give them medications called antipsychotic medications. Now, the advantage of medications is that yes, they're effective, and it's just a pill you just swallow and you go to work. You don't have to spend 1 hour with a therapist. But the disadvantage is that they can come with side effects. Some of them can be addictive in themselves, and you can have a patient who is overly dependent on that medication. So the choice of treatment would depend on the severity of your illness and also the type of your illnesses. If it's not very severe, therapy will just work alone.
Just fine.
That's fine. But if it's too excessive, if the symptoms are severe, the doctor will choose both therapy and also medications. Then also it will depend on the kind of illness that you have. For example, schizophrenia and bipolar mood disorder, unfortunately, you have to take medications for the symptoms on top of therapy, whether or not there's therapy. You also have to take medications for that. So you either
for
take
a lifetime, that is.
Yes, unfortunately, it's for a lifetime. The medication can be tapered down, can be lowered down, or can be adjusted depending on your response to the medication. Yes, but bipolar mood disorder and schizophrenia are all 100% treatable, and you can live a healthy, normal lifestyle without anyone knowing. Yes, if you actually go to Google and Google which international celebrities have bipolar and schizophrenia, you'll be shocked because you see them there performing and doing everything, and no one can know. But that's because they have been very well managed. There's proper mental health care in these countries.
What about autism? Is it the same? Does it fall under the same category?
Yes, it is a form of mental illness, but it falls under a category of neurodevelopmental illnesses. This is a disease that is 100% genetic. It usually affects how your child develops, as far as not at an anatomical level, not the way their brain develops physically, but how they develop emotionally, socially, how they learn to interact with each other and the world around them. So you find people with autism can have problems communicating, children with autism, problems communicating, people, problems with interacting with other people, problems with learning things around them, problem with learning social cues you know, social cues, like vitu unajua nikienda hapa, this is how I'm supposed to behave.
Exactly.
Yeah, but autism can be treated, but mostly it's through therapy, occupational therapy, teaching the child pole pole how to communicate. We actually have an entire field, an entire department called occupational and speech therapy. These are specialists still working hand in hand with psychiatrists who help people with neurodevelopmental disorders, like we've talked about autism and ADHD.
And then there is this, the name has gone, the one which you forget.
Dementia.
Exactly, yes. Dementia.
Dementia.
Yeah.
Yes. So, so dementia also falls under neurodevelopmental and neurodegenerative disorder. But now the difference with dementia is that now the brain is starting to deteriorate, right? So usually it affects people over the age of 50 in their later years of life. So it's partly genetic, and also it might be caused by just the normal aging process of the brain, together with diseases that could affect the blood vessels that supply certain area of the brain, mostly the front part of the brain. It's called the frontal cortex, which is the one that determines how you behave, how you interact with other people, how you control your emotions. So people with dementia, you'll find first of all, they start forgetting things.
Yes.
They start confusing the timelines. They might talk about someone as if they're there, but there's someone who died a long time. And then you might find them being irritable, behaving in an unusual way. Unaona gogo siye tena. Yes. So unfortunately with dementia, there is no permanent cure. There's medications that you can give to slow down the progression of the illness. But with patients with dementia, I like to be very honest with the family members. Is that the treatment I'm giving is only to slow down the inevitable.
Wow.
So with dementia, we give a medication called donezepil, which helps to improve the memory. And also we give medications called cerebroproteins, which help to partly repair the areas that are being damaged. But then again, with the brain is very hard to repair. Right? But it does seem to show some, there's some significant help in a patient who goes through treatment rather than the one who does not go through treatment.
So the one who undergoes the treatment is quite manageable.
Let's say the rate of deterioration is slowed down. Yeah, than a patient who's never gone through treatment at all.
Oh, that is quite, and especially with the elderly.
Yeah.
You see, most of the time they've gotten lost, disappeared. Maybe you just got out there and they disappear. Just forget to.
Then there's another form of treatment for mental illness that we called electroconvulsive therapy. This is a kind of treatment where it's not very well known, but it's very commonly used and very effective, even at Mathare National Teaching and Referral Hospital. So the short form is ECT. It's a treatment where we sedate a patient, and then we pass an electric current through their brain. Right? So we attach electrodes on either side of the head, alafu tunawapiga shock in layman's term. And when we do that, you cause them to have a convulsion. Convulsion ni kifafa kutetemeka. So this treatment is very effective in treating people with treating patients with resistant depression, bipolar mood disorder, schizophrenia, especially catatonic schizophrenia. Ile yenye mtu tulikuwa tunaongea mtu amekaa hivyo asemi kitu afanye kitu. Yes, but this is usually the last line treatment when all those others have failed. Yes, don't think like you come to me, you have depression. Yeah, it's usually reserved for last line treatment, but seem to be very effective as well.
Wow. So now, what is the info that you're passing to our people down there? Because one, we have those people wanaokota takataka. We have all this. You said there are those who just keep to themselves. There are those who are violent. They beat people on the road.
Yeah.
There are those, and camps now, we've really like elaborated on those, and have begun to understand. Is there help for these people? Or unajua huko nyumbani when wanasema nati imekatika and you just left like that.
Okay. It's unfortunately with mental illness, it's just like a lot of treatable illnesses in Kenya. There is help, but there is no access to the help, or at least there is no information or infrastructure to get that patient to a specialist, get diagnosis, and then get access to the proper mental health care, like in developed countries. Even the worst of the worst people, you see they're collecting papers and eating that. Think about the worst you've ever seen.
Yes.
There's help. I have witnessed patients coming into Mathare National Teaching and Referral Hospital in the worst of states, unrecognizable. We give them the injectables, we admit them, we put them on a treatment, we start them on psychotherapy, and on discharge, when you tell them to come back to the clinic after 3 months, it's a whole different person. Yes.
Awesome.
Yes.
Those are success stories.
Yeah.
Yes.
So I think the government definitely needs to put more effort into addressing the scourge of mental illness. And I'm very proud of the Gen Zs. They have shown to be very resilient. And I think with as they come on to power, I think there'll also be a great reconnaissance as far as mental health is concerned. They're very much more aware, they're tech savvy, and they have detached themselves from negative stereotypes, stigmatizations, or superstition like the previous generations. They're aware that if someone is behaving like this, like I'm usually very touched and overwhelmed when I see a group of young people, university students, being brought by their roommate. The roommate telling you, no, I noticed he's not behaving, he's not okay. I think he has a problem. Like you see that time and again. I think that's very wonderful.
Awesome.
Yes. What I will say is this. I think in the next 10 years, mental health is going to go through a change. There's going to be more awareness. And I like to compare it to the period between 80s and 90s when we were starting to get woken up by the scourge of cardiovascular illnesses, high blood pressure and diabetes. There was an increase, but also there was an increase of awareness. Now we're having the same thing happening with mental illness. Not just the aware, but also the prevalence. So I think at the end of the day, you ask me, why is it that there's more cases of mental illness now than there's ever been in recorded human history?
Yes.
We can attribute it to the fact that right now we are more aware than we were before. Because before we were just saying, huyu amerogwa, huyu aliangaliwa vibaya na mjomba, yeah, huyu akona laana. But now we know, oh, schizophrenia, this is bipolar, this is manic. And you can even see it even with celebrities. People are saying, oh, so-and-so could have a problem with mental illness. This musician or this person has, someone go and check on him, he's not doing okay. Yeah? And also number two, so you know how we talked about the hardware and the software of the body?
Yes.
Right? Part of the reason why there was an increase or an influx of cardiovascular illnesses in the 80s and 90s in Kenya is because the way we lived our life disassociated to the way we had evolved to live, right? Like, for example, people are getting high blood pressure and diabetes because we were not used to consuming this amount of food, right? We were not meant to live this kind of lifestyle where you go to the elevator, your car is downstairs, it drives you to your doorstep, you jump into bed, you eat a heavy meal, and you repeat the same cycle, right?
Yeah.
The kind of lifestyle that our bodies have evolved to live is the same life. Have you ever watched National Geographic and see the life of the Maasais? How they walk 6 kilometers, how their bodies look like. That's how we were meant to live our lives. So now when you bring in the calories and the inactivity, you're predisposed to developing cardiovascular illness. Now, this is what has happened to your hardware. A similar thing has happened to the mind, to the software. Human beings are not meant to be exposed to this level of stress in their lives. For example, you have your job, you have what's happening in Russia, in Ukraine, you're being bombarded with what's happening at the coast. Before, you were just concentrated with what's happening in your village. Also, human beings were never meant to get this level of attention and criticism, which now can be accessed through social media and the phone. Also, human beings were never meant to take this many substances into their bodies, this much alcohol and all those other substances that we take. So when we have accumulation of all these things coming into interplay, and also social media, how we live our lives today, the amount of stress that you go through, this is a cocktail that can only result to the deterioration of mental health in the country or in the globe in general.
How is the state of like stigmatization when it comes to the mental illnesses? How do you find it? Is it being experienced like a few years back before things normalize? I don't think they are stigmatized a lot nowadays. If you are found having HIV, so how is it now? The stigmatization about
oh, it's still there, unfortunately, especially with the older generation. Way better with the Gen Zers than the previous generations, but the stigmatization is still there. So much so that sometimes you'll have a patient telling you, like, call my mother, tell them I'm in hospital, but don't tell them which hospital I'm in there, which hospital I'm in, because when they hear the hospital that you're in, it's going to generate a certain level of stigma. We do have people who hide their mental illnesses even from their spouses and even from their partners, which can be something that can lead to the demise of your marriage if you think about it. So right now what we are facing mostly is self-stigmatization, first of all, to begin with, right? Because today, more often than not, if you come clean and tell your friends that you're going through something, they might not take it as harshly as they would years before that. Yes, it's still there, but greatly improving. I'm optimistic of the future, especially, like I've said, with this new generation of people.
That's awesome.
Yes.
It's a positive. Okay, now about funding. Now, as the people who deal with, is the hospital, let's say the Mathare Hospital, known to help such people. Do you get funding from the government, or how do you guys operate?
I can say I visited Mathare Hospital even before I graduated from med school.
Yes.
That was back in 2013, 2014. And I'd say the state back then and right now is greatly improved. We still have a lot of strides to make in the future. We still need more psychiatric hospitals, still need more specialists. But the funding has improved, but still not enough to cater to the growing demand of mental illnesses. There's still, we still need more wards, we still need more beds, need more hospitals. We still need more uniforms for the patients just to improve their general well-being, because when you're in a proper environment, when you're well taken care of, the recovery rate is much faster. But I also appreciate the fact that these days there's private facilities where you can go get checked in and get treated. Yes, but still the general access for the average ordinary Kenyan to mental health care is very, very bad. The government still needs to funnel in more money, because if you were to see how much money we're losing due to untreated and diagnosed mental illness as a result of maybe low productivity, people missing work, people spending long times being hospitalized, because you know when you're hospitalized it has to be funded by NHIF, right? It does amount to the billions. I don't have the numbers, I don't want to make it up, but it does amount to the billions if you can actually distill how much money we're losing as a country. For example, if a patient who has bipolar mood disorder is on treatment and on follow-up, the patient is not likely to develop a manic episode. And then the doctor or the healthcare provider can detect that the patient might be developing a manic episode. And then you can adjust the medication, and then we can avoid admission. Because now when you admit a patient for over a month, in Mathare National Teaching and Referral Hospital, we are directing funds, right, to the in-care patient, in-care management of that patient, which is very expensive. So if we were able to educate the person who's suffering from bipolar disorder, make sure they have access at least a monthly visit to a psychiatrist, or even 3-month visit, depending on how well they're doing, we can avoid the patient coming to Mathare, depleting NHIF funds, and also have the patient maybe being productive at work, generating revenue and paying taxes.
Awesome.
Yeah.
You mentioned before, maybe you still elaborate about it, the kind of patients you get. You see, more women than men? Is that what you said? The people?
As far as Mathare National Teaching and Referral Hospital is concerned, there's more male than female patients. Not to say that mental illness, okay, so that being because you have patients with substance use disorder, which usually affects men significantly more than women. That's partly because men and women just have different ways of coping with stress. Men will go to the bar, women are more likely to go to church or go and talk with their friends.
Exactly.
And that just talking with friends or just praying is a form of therapy.
So yeah, women are helping themselves.
Unknowingly.
That's awesome. That's awesome. Okay.
So that thing which you criticize women for
is actually good.
Yes. As a matter of fact, but don't quote me on this. Gossiping is a form of therapy. When you go to the bathroom and talk about how your workmate was bothering you, or how the feelings you have towards them.
You're pouring it out.
You're pouring it out.
Yes.
Good for your mental health, bad for HR.
It's good. So we continue helping each other responsibly. Yeah, that's awesome. Okay, another thing which almost escaped my mind. So we were still in Mathare as a facility.
Yeah.
You see, when you mentioned Mathare, imagination is that just people who come there are just mental. Mental and excess mental. I was even imagining that there's a big word for people who are just like, you can't control them.
Yes.
Just, yeah.
Okay.
So how is Mathare? Is Mathare overview of Mathare? Who can walk in there?
All right. So before I say that, I would say I will partly lay the blame for the stigmatization of mental illness in how the psychiatric community dealt with mental illnesses before. During the colonial period, we would just lock them up, without proper understanding or proper care. So that helped to lay the foundation or the basis of the stigma that you see today on mental health. But Mathare National Teaching and Referral Hospital, although I'm not their spokesperson,
Of course.
they have done a lot to try and rebrand the hospital and also what they do for their people. Number one, there is a change of their name. They're no longer the Mathare Hospital. No?
That's why I was even like confusing when I saw MTR. I'm just like, it never came into my mind. You're talking about Mathare.
Yeah.
Yes.
Yeah, that's why you asked me how is all Eldoret.
Yes. They were like Eldoret.
Hey, shout out to the people of Eldoret.
Yes.
Tuma salam.
Exactly.
So we now call it the Mathare National Teaching and Referral Hospital.
MTRH.
Yes, because now we have a general outpatient. Even if you have malaria, you can go to Mathare. So because someone is Mathare, we have a dental unit. So we are seeing much, different illnesses, not just mental. Yeah.
So anyone around there, if you need to see a physician, just walk in there.
See a dentist, just walk inside there.
Yes. Awesome. Anything else you want people to remember about the mental as we conclude? Something. Our time is.
Yes. Okay.
Take home.
A take home.
Yes.
They're already at home. I think what you can take away from from what we've been talking about, knowledge is power.
You speak to that camera.
In life, I always say there's very few things that you have control over. You know, you cannot control where you're born, the gender, or the skin, or the country which you're born into. So for the little facets in life that you can actually control, I think you owe it to yourself to control it. You owe yourself to learn these things and to know when to see a specialist. Despite the fact that we are facing a huge mountain, a huge burden of mental health, there's never been a period in history where it's much easier to fight illnesses than it is right now. We all have access to information, to computer. Take it upon yourself to take care of not just your body, but also your mind.
So, thank you so much. Yeah, you asked about Salam when you are in Kass FM or Kass TV.
Can I do that?
You can just
I was just joking. Hey, listen, I'd like to
yeah.
to say to the people of Kapchemgum.
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 Yes,
All
it's
right.
Kapchemgum, Jebrok,
Yes.
Gambogi.
And we'll enroll you
Also
to...
Eldoret. Yeah, Eldoret people.
Yes. You see, when you're Taros, we'll enroll you to some classes, and then next time we'll be conducting this interview.
I would actually love
with,
that.
In
yes.
Kalenjin.
Yes, it's actually one of the regrets I have in my life, not taking seriously Kalenjin language.
Yes.
Yeah.
But it's something with the Gen Zs. We all have in our children. They actually, I think it's something we need to focus and try to before it become extinct.
Yes, actually there are certain, for example, I am a Terik, right? So according to Wikipedia, there's only 24 to 25,000 of Terik people. The language is slowly going extinct. Yeah, that's something we need to work on. Yeah.
Terik, Kapsengere part there.
Kapsengere, yes. Yeah. Kapsengere, Kapchemgum.
You're right.
Hello, your son has made it.
Sure.
I'm here with Carol.
Thank you. Thank you so much. You're so grateful, Dr.
Okay.
Thank you for creating time to really come out of your busy schedule. You've really had time for us, and we've benefited from this. So welcome again for another session. We'll welcome you to come and still polish us on this. Really know much broader, because I've seen mental is actually broad.
Yes.
So you'll come and still furnish us with information.
Yes.
Help us a lot.
I think also something if I can add very quickly is mental health, especially with men, needs to be addressed very carefully and very differently. For example, the rates of suicide in men is 3 to 5 times higher than in women. Yes, despite the prevalence of the mental illnesses being more or less the same. Yeah, so I think there's just a general and a cultural problem in how we treat men and how we address and approach the mental health issues, both from the gender within and without. Yes.
So
I think that a lot of strides, a lot of education, a lot of re-education and reculturizations need to happen. Unfortunately, especially with the Kalenjin culture, and in how men are expected to behave and move in a certain way and not show weakness. I do appreciate the significance of that culturally, because we were surrounded by enemies, and you don't want to show your enemies your weakness.
Yes.
But like I say, we now live in a very different environment, an environment where a man and a woman can sit at the same table and talk as equals. So we also need to change and re-strategize how we take care of ourselves and cut off the negative cultural practices that are bringing us down and embrace the positive ones. Yes.
I think, Dr. that calls for another day for that discussion, so that you take us through that.
Yes.
Because for real, as you said, we are experiencing a lot of suicide from the men.
From men, yes.
Yes.
Yeah.
Yeah, we'll discuss that in upcoming program when we get to organize that. So thank you so much, and thank you for coming. Kongoi missing?
Rudy Eldoret.
Kaka itletu watu tujeni wa Tililindo rani hagumite ak Daktari Hilary Tarus, and then it's called psychiatrist. eng sipitalit notok nebo Mathare. Kainenyu ko Chesankaro nebo Rapsirwa, testai ikase Kass TV, akoi ketuye kokeny, rip mising ak kabwatutikuk. Ak inai ile ngotko itindoi miondo nebo kabwatutik, icheng toretet, mi toretet ne notok ko iityi sipitali asikobit keker mait konakta miondo amu kakoarorwech daktari kole inoktoi miondo nga ngot iker kotako kitikin kotakelen oye kang'et natit kidogo kalya komutai kokakoet miondo. So yakiker kemi tugul ko ngikonkei asikobit ketoretokei. Testai ikere Kass TV, kimnatet naet.